second.
Are you still seeing my screen?
Yes, so we can see your screen. But
Only the slides?
no. You'll have to stay on the slides only, Hanji. We can see
Okay,
you, we can hear you, and we can see your presentation.
okay. Let me know when to start.
Yes, sir. Yes. I'll just thank you everyone for joining in. Welcome back. Today we have Dr. Anoop with us. Sir, thank you so much for joining in. And on this note,
My pleasure.
so your presentation it went away again. Now it
1
is
minute.
on.
Yeah, now I'm fine. Yeah.
Yes. Sir. So on this note, sir, the floor is yours. We are ready when you are.
Okay. First of all, I welcome everybody. Um, for me, virtual shadowing is a new concept, and I was going through the benefits of virtual shadowing yesterday, actually, and I found that it's benefiting doctors all around the world. It's benefiting young doctors, especially because they are being able to train themselves sitting at home, watching how patients interact, watching how senior doctors interact with patients with live videos. So I sincerely thank Arushi's Dental Club for organizing this program and the hard work behind gathering people at this point, especially students who are eager to learn, is a big thing. And before we go into the presentation, I sincerely admire the efforts that all of you have put together. Uh, it will definitely benefit you, and I hope that today's presentation, at least a few points, you might be able to take home with you. Myself, I'm Dr. Anoop Nair. So, for most of you who don't know me, I am a consultant endodontist. I'm based in Trivandrum, and I'm also a very passionate aesthetic and restorative dentist. We'll come to all of these things. And I also have trained myself in something new called microscopic endodontics, which you might be aware of. I also train and I'm a teacher to a lot of students. So I'll give you a glimpse of my activities and what endodontics is as a career option for you. And I would also like you to go through a few of my cases because the way we work at present might give you an inspiration to change your work pattern, I hope. And this is where I am from,
Sir,
Trivandrum.
sir, I'm very sorry to
Hello?
interrupt. Sir, I'm very sorry to
Yeah,
interrupt. But I can't see your video.
yeah. Please.
So maybe you turned off your.
Can you see the slide?
Yes, sir,
Oh,
we
you
can
can't see
see.
my video?
Yes, sir, your video is not. You are not
Yeah,
visible
I've
to
turned
us.
it off actually.
Okay, all right, no problem then.
Okay, now,
Yes, now we can see you.
okay, now it's back on.
Yes, sir. Yes, sir. Whichever way you're
Is it
comfortable.
fine now?
Anji, yes, sir. Your slide. Yes, sir. Definitely. Go on, sir.
Okay.
Sorry.
So, like I was saying, I'm from a small town called Trivandrum. The reason why I'm mentioning the word small town here is because dentistry practice, as I've seen, changes in a class A tier city to a B tier city nowadays because the competition levels are different. The patient information, the patient education, the patient awareness, and even conducting a training camp differs in all of these cities. So if you are in a tier A city, like for example Delhi, Bombay, Chennai, Bangalore, you might find a very strict competition around you when you start your practice. And it's all about maintaining the clinic, paying the rent every month, working out your patient fees, etc., depending on how much your expenditure is every month. But when you come to a tier B city, which is a great option for you all to settle down, the competition is much lesser, and you will actually find patients are more aware and they are willing to come to clinics who have got a good practice history rather than the present trend of chain of clinics and all that you see in tier A cities. So this is my city, Trivandrum. And for those of you who want to reach me after the program for any clarifications, doubts, any guidance, I'm available at all these social platforms. I would highly recommend all of you connect with me through LinkedIn because because you can put in the keywords Anoop Endo. So you'll find me on LinkedIn, and that's a great way to see my activities on a daily basis, and I can in turn see yours, and we can all work as a team. Now, what do I do? I am an endodontist by career. Where did I start? I started way back in 1999 when I joined for my BDS, and almost from the fourth year, I was quite sure what I wanted to do. So, if you ask me where do I plan to be, I don't know. In the next 10 years, I don't know where exactly I will be, but I'm pretty much sure that I'll stick on to my specialty field because it's very promising and it's being changing on a daily basis. And there's an important question we need to ask ourselves. Does anyone actually plan? A lot of us don't. A few of us do. And most of us just live with the current scenario. So planning helps actually. But the last 2 years, we have seen that many of our plans have actually turned uh, not what we expected because of the COVID situation and all that. But planning is very important, and I'll come back to that. A brief history of how I became a dentist. I did my schooling in Trivandrum. I did my BDS in 1999. I graduated in 2005 from Madras Dental College, Tamil Nadu. I was a very average student. I was not a rank holder or I was not class topper or anything. I was just an average student, but I was very keen on enhancing my clinical skills. But that happened towards the third year. So first 2 years, it was just getting introduced to a new subject, getting introduced to what is dentistry and all that, because I'm pretty much sure that none of us planned to be a dentist, or we never decided that our ambition as a child would be to be a dentist. So yes, I happened to be a dentist, and the first 2 years were quite new to me. But towards third year, when we started seeing patients and we entered the clinic setup, I started liking the subject, and clinically, I was quite interested in studying, not the textbooks. So by the time I graduated in 2005, I wanted to jump straight away into clinical practice, and I joined the clinic as an associate, which most of us plan to do and we will be doing. So after I joined as an associate, I worked a few years, about 2 years to be precise. So once I worked for 2 years, and my salary started moving around from a four-digit to a five-digit number back in 2007. I understood that I need to move to a better platform to work. So that's when I decided to do something better. But PG was not in my mind back then. So I moved to Saudi Arabia as a general practitioner. So I'll give you an idea of how it is to practice in these places and what are the benefits and demerits of this. Then about 7 years, I practiced in various places. Like I worked in Saudi Arabia, I worked in UAE, uh, and then I returned back to India for doing my MDS in 2012. But after 7 years of practice, I was pretty much sure that I wanted to choose endodontics as my subject of specialty. Now, why I chose to do MDS, why endodontics, I'll explain to you. Now, other than these two things, have I done anything else? Yes, I've done two prestigious fellowships. I've done a few hands-on courses, and whichever webinars are available, whichever conferences are available or seminars are available, I'm always interested to just watch, learn, because it's a never-ending process. And nowadays, it's very easy because you have a cell phone, you can attend any webinar, even when you're working. So I don't miss a chance to attend anything to learn, because I believe that only the updated person can actually fight the competition around you. As a work experience, I have about 7 years of work experience as a general practitioner. And in 2015, after finishing my specialty, I've restricted myself to a specialty practice. So for the past 6 years, I'm doing endodontics. I'm doing a lot of aesthetic work and respiratory work. I'll give you a glimpse of all that. So my specialty and my experience, it ranges over 13 years now. Now, what is the difference? What did I feel in the last 13 years? So has anything changed from the time I passed and to what it is in present? Yes, a lot of things have changed. So as a general practitioner, I was doing everything that was available. I was doing a bit of root canals. I was doing some crown preparations, minor periodontic procedures like crown lengthening and all that. I was even fixing brackets on patients in some clinics. So it all happened, but I was not sure of what I was doing because I was not a very keen learner. I forgot to understand the part that there is no practical without theory and there is no theory without practical. So basically, I was just working. Every day I used to go to my clinic, I used to spend some time, I used to see patients. Uh, I did some shadowing, not virtual shadowing my seniors, shadowing consultants who used to come to my clinic. I used to stand near them and see them work. Some of the things I picked up, and some of the things I forgot to pick up or I didn't pick up. And a lot of reading I didn't do back then. But anyway, after moving to Saudi Arabia, after working in all the Middle East places I could, and coming back and becoming a specialist, the difference I could find was that by being a specialist, you are focusing on something narrower. You're not focusing on all the aspects of dentistry. So, skill enhancement as a specialist is more because you are doing only one or two procedures on a routine basis. Now, as a general practitioner, your options are you can work as an associate dentist, part time or full time. You can work in India or you can work abroad. Once you're promoted, you can become a dentist full time in India or abroad, or you can start your own clinic. The upgradations are at present to own your own practice or to start a clinic. Now, when you start a clinic, the commitment is full time. It is a non mobile job. You have to be present in the clinic, and it is a very competitive job. You have to be good in marketing yourself, marketing the clinic, and you have to be always on the lookout for competition around you. Now, if you ask me if there is any demerit to starting a practice, um, there is no upgradation in your designation. That is the only demerit. You will remain a limited general practitioner, which is definitely not bad. The highest income revenue is by a general practitioner in India. Specialists don't get to make that kind of money if you look at economically, which is better. But then, if you want to broad out your options in a career, you may need to think about becoming a specialist. Now, as a specialist, what are the things I could see? When you're a specialist, you do a specialized work. Like an endodontist does root canals, basically. An oral surgeon limits himself to surgery work. And there is a wide acceptance from the patients because nowadays patients know the dental specialties available. They know the specialties in medical setup as well. So they would prefer to go to a specialist. So, an acceptance point of view, it is much easier for you to show off your work to a patient when you are a specialist. You can earn without having your own clinic. So you can either be a consultant, you can get attached to a college, you can start your own academies. A lot of options are available where you can teach or do anything. So without a clinic setup, you can have a revenue as a specialist. Research acceptance is more when you are a specialist. So you want to join a PhD program, you want to do an article research, short studies, anything. It works when you are a specialist. Acceptance to many of the PhD programs, especially in India, is only after you become a specialist. So if you have completed your MDS with the DCI norms, you can apply for any PhD program in India. Other things are some of the countries accept you as a specialist if you have completed your post graduation in India. So if you want to go to the Middle East, for example, it is accepted. But some of the countries don't accept Indian degrees. So that's different. Now, if you are charging high, patient acceptance is again more when you are a specialist. They probably understand that there's a more delicate procedure and they won't be hesitant to pay you. So, consultant options are there, teaching and training programs if you're a good speaker, and better skill enhancement as practice is only one specialty. So, these are the differences I saw as a general practitioner and as a specialist. Both the options are amazing, but the only upgradation, like I told you, as a general practitioner is either to move abroad or else to start your own clinical practice. A lot of options in moving abroad. We have Canada, we have Australia, New Zealand, UK. Migrating options are there. So a little bit of studying, a little bit of training yourself can get you into any of the developed countries. I am not saying that a career in India is not without a future, but I am just giving you the options you have in front of you. Now, other options are there when you want to plan ahead. If you are going to stay in India, you may need a post graduation or a clinic. You may need to do fellowship programs or short courses, PG diplomas, for example, to train yourself so that your work gets better. I'm not saying the training that you get from your college is bad, but we all know that as a BDS graduate or as an intern right now, because I'm told that most of you are studying now, so you're all students and you are thinking of possibly settling down after your studies. So when you are studying, you know how much you get to study. So we are very hesitant to ask. We might see a video of rubber dam on YouTube, but when we go as an intern back to college, we are very hesitant to walk to our professor and ask him to show us rubber dam because we feel that the professor may be hesitant to show us. Some of them are. I'm not saying no, but if you want to train yourself better as an intern, you have to ask. So that is a good option if you're an intern in a college. Otherwise, you have to join for any of the training programs that are available around you, and you have to prepare yourself. Now, there are a lot of options as a non-clinical scenario also. You can do your hospital administration master's program. You can get into clinical research, public health. For example, I put a link below. Some of you can just visit the link to see some of the non-clinical options masters that you get to do. And they are as well good options if you're planning to leave the clinical scenario for a bright career. So these are all options if you are going to stay in India. I'm not converting this into a career guidance program, but I'm just giving you an idea because you need to know what to do. Now, other than all of this, you can always move out of India for work, or you can move out of India for residentship and become a citizen in an accepted country and think about working as a dentist. So these are all the options you have in front of you. Now, how is it to work in my specialty? Because when I spoke to Arushi about the program, she told me that the outline of the program includes me talking about my specialty and telling you what it is, so that those of you who are interested in endodontics or conservative dentistry as a career can get an idea of what to do. I promote whenever I can. I promote. So this is just a screenshot of a program I did on TV uh, to propagate root canal treatment. So I do this whenever I can. So why my specialty? So I told you I was a very average student when I was in my BDS because I was disoriented. I was not sure which subject I should put my foot down to. I was not pretty much sure as to where my career will be. So the things changed once I started practicing. So as a general practitioner for about 7 years, when I joined for my PG, I already knew how to do a root canal, at least not precisely, but I could manage a root canal, a rotary root canal, because I was doing root canal on a daily basis. So it was a good program for me to join after a break. So once I joined, I did my level best. So you might see that everybody puts up a board as a gold medalist in clinics or all that. So I want to show you uh, my board in my college still where I am a gold medalist. So that happened because I put my sincere efforts for 3 years as a postgraduate student and I studied very well. I picked up whatever I could from every professor, everybody I met, every junior I met. I have even picked up from my training assistant, dental assistant, or the nurse in my clinic. I've never known how to mix glass ionomer, for example. I learned it a couple of years ago from a dental assistant. As a postgraduate, I did not know how to mix. So there is nothing that can stop you from learning. You can learn from anybody around you. Why conservative dentistry and endodontics? So this subject is actually divided into two. So other than what you know, I want to show you what is left in it. So conservative dentistry is also called operative dentistry in some countries. It's also called restorative dentistry in some countries. There is a master's program in UK known for restorative dentistry also. So why is it important now? Why should you think of this as a career option? Because this is the golden age of bonding. We all know this is adhesive dentistry time. That means we are all going back to adhesive dentistry. There is no more of fluting crowns. There is no more of using your glass ionomer as a adhesive base. Now this is all about bonding, bonding to enamel. This is the time of inlays, onlays, veneers, where we have amazing results when we do micromechanical retention, adhesion to tooth. So this is all a time of adhesive dentistry and it's evolving on a daily basis. So we are all seeing people going back to the times when onlays and inlays were considered better than crowns. Tooth preservation or biomimetic dentistry, for example, injection molding, all these have come up so much that we are going back to the age of composites. So the future is definitely in restorative dentistry, indirect restorations, veneers, digital smile designing like DSD, if you have heard of it. There are a lot of softwares that can plan smiles for patients and they can give amazing results. All this is a part of operative dentistry. If you have heard of CAD CAM, chair side milling, where you can actually print your crowns, print your onlays, and give it a single day. So these are all coming up on a wide scale now, and these are becoming more and more popular. The cost of these devices are decreasing. So because of all these reasons, this is the golden age of restorative dentistry. So this is the time when you should actually think of this as a career option. The second part of it is, of course, endodontics. Endodontics, we all know, is root canal treatment. Now, root canal treatment, let it be surgical, non-surgical, and all that, they have advanced over the years on an alarming rate. Now we have CBCT for diagnosis. We have the dental operating microscope. We have rotary machines and files. We have good isolation techniques. We have superior irrigation possibilities in root canal. We have three-dimensional obturations. So why is endodontics an interesting subject? It is because the treatment usually is covered in a single visit. And basic treatment for any major case, no matter which full mouth case you want to plan, which periodontic treatment you want to plan, you want to give bridges, you want to give crowns, you want to give any trauma cases, whatever it is, the basic treatment, the underlying treatment is always an endodontic treatment to remove the infection from the tooth. So this has to be done for no matter any case you take. And it is always upgraded on the go. It's a very gadgety subject. That's one of the reasons why I chose it, because I love gadgets. So we are always on the move. There is a high success rate for root canals, and because of the high success rate, it gives us a very promising future. So about 97%. So 100 root canals, only three has a chance to fail. That is even much higher than, uh, for example, implants. So if you talk about implants, they never mention the word success rate. They always mention the word survival rate. That is just because it is a method of surviving. Implants are bound to lose bone around it. So always success rate is for natural tooth, survival rate is for implants. So endodontics has a bright future. So altogether, this is a very promising subject. And I am ready to help any one of you who want to get trained in it or want to get any guidance in your career. And I've actually put forward some interesting ideas into this presentation to help you with the same. So I'll just try to show you some of the things that we have so that you get an idea of what I'm talking about. So we have scanners nowadays. So scanners, if those of you have not seen it, are the easiest way to take impressions. So we have scanned impressions which can be sent via email to the lab, or you can even send it to your chairside milling unit and you can get a crown printed in about 1 hour. So a patient walks to you with pain in the morning, he gets a root canal done in about 1 hour. He can wait, we can do a tooth preparation, get the scanner ready, get the scanned impression, mill the unit, and give the crown in less than 3 to 4 hours. So by the time he comes to your clinic at 9:30 with a painful tooth, he goes back with a good bonded restoration by about 12:30 or 1 o'clock. So this is called single day dentistry. Single day dentistry or 24-hour dentistry, which is getting very popular in countries and very popular in India now. So I'll just show you a video how fast you can scan an impression. So this is a video I took from the clinic to show you. So this is an onlay that we have prepared, and all you need to do is run the scanner around the impression, around the tooth that is prepared, and it makes a three-dimensional image of the scan area, of the impression area. So all you need to do is make a three-dimensional image like this and send it to the lab. So it gets very fast. Patient doesn't have to go through the trauma of placing an impression material in the mouth and going over a gag and all that. So very easy. Again, CBCT, if you know about CBCT, one of the most superior methods for diagnosing any of the problems. But I would like to show you one or two cases where it can help you in endodontics. So that's my daughter. She loves to pose, and this is her posing in front of a new CBCT machine. So CBCT will give you instantly 5 images. So if you take a CBCT of a patient who comes to you with a painful tooth or a couple of teeth, instead of going for full mouth X-rays or an OPG, OPG is something that I am totally against because it is not at all clear and it doesn't give you an idea of anything. So either a full mouth X-ray that you have to take or a CBCT. So CBCT will give you 5 images like this. I'll just give you a glimpse of how it can be helpful in endodontics. So if you take these 5 views and if you look at the bottom right view, that's the axial view, that is the only view that you require for endodontics. This view that's a caries or endodontics because it gives you an occlusal view. And as you go from occlusal to apical, every millimeter of the tooth is visible. So if you get an idea of how many canals are there, you can easily work. See, for example, this is an axial view of the maxillary second and third premolar. Sorry, second and third molar, upper molar. So I am planning an RCT of these two teeth, and before doing the RCT, I would like to know how many canal are there. So CBCT will give you a good idea of how many canals I should expect. So if you can see, there are 4 canals in both the teeth. So without a CBCT, if you rely on an X-ray, you might miss out the fourth important canal. Why a CBCT is very important. Now, if you take a traditional RVG or an IOPA film X-ray, this is how you see the film. So if you look at the molar tooth here, which has a very big periapical lesion, the canals are well obturated, and you might wonder why the lesion happened. So let's take a look at the CBCT. So when you take a CBCT and you take a look at the cross section of the tooth, the axial view, like I told you, there is a missed palatal canal which was not obturated, and you can see the bone loss around it. In an X-ray, this bone loss will only become evident when it has reached the cortical plate. But in a CBCT, you can see it as early as the spongy bone. So that is why a new method like a CBCT is very important, and you all need to get trained very well in CBCTs. The next important tool that we need is a dental operating microscope. So the microscope I'm using in this image is a Labomed Magna. For those of you who are interested in gadgets, you can go and check Labomed Magna. So one of the most advanced microscopes we have in the world now. The advantage being it has a handle which you can hold like a bike's handle, and you can move around easily. So if the patient moves her head or his head, it's not a problem anymore. You can adjust it very easily and you can work it without any effort. So this is a very good operating tool for doing endodontic procedures. Now, what are the cases I do, or what is it that I do on a daily basis? So some of the cases I would like to show you, I've selected 10 cases to show you today, so you get an idea of how to work. I do root canals, for example, and since I specialize in root canals, I often get cases which are referred from elsewhere. Like this case, for example, is a calcified incisor. If you can look at the tooth, the canal is barely visible, and the initial access opening you can see in the first image. So the dentist who tried to do it has tried to locate the canal, but he could not. So with an operating tool like a microscope, you can easily trace the canal. So you can see my tracing file there in the second image, and in the third and fourth image, you can see the canals easily obturated. So this is one advantage of having magnification. So it need not be a microscope. I'm not telling all of you to buy a microscope tomorrow. You can start with dental loops. So loops are a great way of starting working. So when you are in your second year BDS, preclinicals, you should buy a loop and start working with preclinical phantom jaws using loops, because that's the easiest way you can learn how to use a loop. Don't worry about your teachers. Tell them you're really crazy about magnification, so they might not hesitate to help you. Don't worry about others watching you or telling you that you're causing unnecessary competition for them. If you have to learn, you have to do it. So, second year preclinical time is the best way because you're working on extracted teeth. There is no risk of any injury happening to the patient. So, start working with loops as early as second year. So this is a case of a direct composite restoration. So if you look at the first picture, you can see a badly done restoration with the diastema closed completely. Now it is discolored. Now it has leached out. Lot of monomer unreacted. If you know about composites, so we have just removed it, done a direct veneer preparation, and we have finished it with direct composite in the third image. So I love doing composites. So again, as an intern, you can always start doing composites, diastema closures, etc. If you are not sure, ask your seniors to help you, or you can attend any study programs to train yourself in doing better composites. Now, sometimes you get lone standing teeth which have to be saved. So this is a lone standing upper molar, and the prosthodontist wants it to be saved because it is the only abutment tooth. So you don't again rely on an RVG or an IOPA film. Take a CBCT, find out what is the condition of the tooth. So a tooth that looks very good in an RVG, for example, if you look at it, it looks very good. But see the CBCT. I have played the CBCT image in the center. See the amount of caries that is there in the tooth. It is badly cariosed. So you have to take a CBCT, understand that the percussion is not fractured, make sure the tooth is intact and all the canals are open, and then you can do a root canal treatment. So the root canal treatment is done in the third image. So these many canals and work you cannot assess from a X-ray. So again, importance of choosing newer diagnostic methods. If you take a look at this, it's a poorly obturated tooth which has started showing signs of resorption. So all you need to do is use a good apex locator, find the exit, and do a good obturation. So if you can see the pre and post images, I have increased the working width and I have obturated it well. So working length is something we all learn as students. We are all taught the importance of working length, but nobody teaches the importance of working width. So you have to go back today, and if possible, this is my homework for you. Read about working width, why is it important, and how you can do a good RCT with working width. So this is a very simple hand RCT with a cold lateral compaction, which all of you can do. So learn about it. So this is a case of again large spacings in between medial incisors and lateral incisors. So if you can see the preoperative image I have put here, the patient wants these spaces to be closed. So you take a good impression and then you can do a direct veneer preparation. So this is a case of composite veneers or indirect composite veneers. So the first case I showed you was a case of direct composite veneers. This is a case of indirect composite veneers. So there is a specific way of doing a veneer preparation which you have to learn. And after doing that, you can get veneers like this fabricated from the lab. And once you get them, you can bond them to tooth to close the spaces and give a bonded restoration, which has a life of at least 10 to 15 years. So this is a better way of doing a restoration rather than choosing a direct composite filling, which will be very technique sensitive and have chances to fail. Now, sometimes as a specialist, you may have to do teeth with severe curvatures. You can always start doing these cases and try to do them. So this is a case which we call an elbow curve, which because it is almost a 45-degree bend in the apex, you can slowly sit and scout these canals and obturate them. Sometimes you may have to correct ledges. So ledges are a basic problem when you start doing root canals. So the first impression, first image here, you have canals that are not completely obturated or not obturated to full length because the doctor who was trying to do the root canal has ledged the canals. So carefully you need to scout the canals, find the exit with an apex locator and obturate it. So you can do ledge corrections. Sometimes you will get cases where somebody has separated an instrument or you can separate an instrument. It's a very common error that can happen when you are trying to do root canals. So again, you can slowly retrieve the instrument with a skill that you are probably acquire over years.
How to treat a ledge case, sir?
Yeah, I have a question there. How to treat a ledge case? Would you like me to answer it now, or do you want to answer it in the end of the talk?
Now,
Now, okay. See, ledge case correction is not something which I can teach you theoretically, but then I'll give you an idea of how to do it. So basically, there is a canal that is already ledged by somebody. So what you do is you remove the existing restoration from the canal, that is basically guttaparcha and sealer and all that. So a couple of techniques are there. One is once you remove the contents. So if you see the second image in this, that image is after removing the primary content, that is guttaparcha. Remains of the sealer you can see there. So once you remove the primary contents, what you can do is you can keep a slowly fitting GP into the canal. That is without obturating, without sealer, anything, just a master cone GP. And once you place the GP, you should understand that the GP is now in the ledge. It has gone and it has stood its place in the ledge. Then you can introduce a new K file, a small K file, through the side of the GP, and you can go into the canal. And now the K file has a higher chance of finding the canal because it is not going to go into the ledge again because the ledge is already blocked by the guttaparcha. So this is one way. Another way is instead of using a guttaparcha, you can use a larger file into the ledge, and then you can introduce a smaller file into the remaining area and try to scout for the canal. Otherwise, you can use something called a pre-curved K file. So again, go back to Google, find how to pre-curve a file. And once you have a pre-curved file, you can introduce the pre-curved file into the canal and slowly sit and rotate your hand in watch finding motion and try to find an opening into the canal other than the ledge. I would always suggest as a beginner to use an existing file into the ledge canal and use a secondary file and try to scout for the canal. So probably you will get some free videos and all that on YouTube for ledge corrections. Try to get an idea. Otherwise, you need somebody to train you with these things. I hope you get a good idea of what I was trying to explain, right? Okay, I hope I'm clear. I'll go back to the next slide. So this is a case of separated instrument retrieval. So instrument retrieval kits are available. So there are a lot of scaling tips available, endosonic tips available for retrieving instruments. So again, it's a technique where you need a dental operating microscope, not possible with your visible naked eye, because to retrieve an instrument, you have to see the instrument. To see the instrument, you need a dental operating microscope. So this is something you can possibly train yourself over a few years and then attempt. Sometimes you may need to manage open apex cases. So these are all cases that I get sometimes. So you get poorly done obturations like this in wide open apexes. So if you look at this case, for example, this is a case where there's a large periapical lesion and the canal is poorly obturated. So as a primary thing, what you do is again remove all the contents of the canal. So I removed all the guttapercha, and once I remove the contents of the canal, I introduce my file into the canal to see the length. So once I get the idea of the length, uh, I will start my irrigation procedure because it's a very open apex. There is not much filing I can do here. So there is no point increasing the working width. What I need to do is disinfect the canal. So we have a lot of chemicals available. We use some of them like chlorhexidine, etidronate, hypochlorite, all those things, saline, alcohol wash, everything you can use. So once you get a uh, good irrigation done, this case we have used something called a PRF. So you should all know what PRF is. It is widely used nowadays for periapical surgeries, periodontal treatment nowadays into endodontics as well. So this is from the patient's own blood, so it doesn't have any allergic reactions. It can be introduced back into the patient's tooth. So once we get a PRF plug, which is rich of growth factors, we introduce it into the canal. And once we have it into the canal, we push it into the apical area. It acts as a barrier in the apical area, and it helps us pack something called MTA into the apex. So once you pack MTA into the apex, in this case, you get a tight pack in the apex because PRF membrane fibrin is already there in the apex to hold the MTA. So once you get a good packing like this, you are pretty much sure that the open apex is now three-dimensionally sealed. Once that is sealed, you can use a good guttapercha injecting material and you can do a good restoration. So this is a pre-operative radiograph of a poorly done restoration because you can see the voids in the guttapercha and all that. So with the right technique, you can get a good obturation like the one I've showed you here, where you have MTA in the apex and guttapercha in the main body of the canal. So these are all just uh, my attempt to make you guys interested in the subject of endodontics. So again, some cases where I showed you already a direct composite veneer, I showed you an indirect composite veneer. So this is something called an indirect ceramic veneer. So the only difference is the material is ceramic. So sometimes you may get patients with dystema with existing composite fillings, badly done composite fillings, discolorations, etc. You can always do beautiful veneer preparations if you get yourself trained, and then you can always have these kind of ceramic restorations to give the patient a better closure of his problem. Now, this is my work, what I showed you. Now, if you want to work efficiently, you have to have a passion for the subject. So this picture I put because this is the picture of one of the earliest apex locators. This is a 15-year-old apex locator that was introduced by J. Morita in 2006. And this used to run on something that
भाई
we
एक बार रुको
commonly
अभी
call
मेरे को
pentorch
बोलना है
batteries.
वीडियो नहीं ऑन
They
करो
never
कुछ
used to
बोलना
have
है
any charging mechanism. So it needed 8 pentorch batteries. So I've kept it even now because this is a second generation apex locator. It's not accurate anymore. But this is my interest in the field. I don't throw away gadgets. I keep them. I like to see them every day around me. This is just my dedication to the subject. So if you want to do something, you have to be dedicated. So that's my only sincere attempt by showing you this photograph here. I myself am a faculty for a German university, Greifswald University. We have a lot of training programs in India. So we have fellowship programs for students in aesthetic dentistry. We have PG diplomas in aesthetic dentistry. We have some certificate courses. We have endodontics. So we have a lot of certificate courses. You can always find the details of all of my courses in this website. Go to ilamet.org and go to the dental courses section. So other than dentistry, this organization also have a lot of medical cosmetology courses which dentists can do, and you can take a look at all of them. I am the dental mentor for all the training programs in dentistry from the university, so you can get back to me for any details regarding the same. I'm not insisting all of you should do these things, but it is a good way of enhancing your skills, which you may not get from your basic college teaching, or you may not pick up from a clinic that you are working as an associate. So I organize a lot of training programs in India. So this is before the COVID time when we could actually interact with students. So endodontics was trained on patients on extracted tooth. We used to have wonderful programs all around the country. So I have a big passion for teaching actually. So it's always an interesting thing for me to train students in the field of dentistry. So I've traveled to almost all the city in India now, and I've conducted courses. I've conducted courses in Sri Lanka, Bangladesh, Maldives, UAE. So we have training programs all around the world. We have good programs that can get you guys in a better way of doing dental procedures. So all you need to do is put in your heart and just look around you. A lot of options are available as young dentists. You can always pick one that suits you, which one you have an interest to, and then you can always do that. Now, uh, this is of course your work, this is of course your passion, but to do all these things, you need a strong support. You need your family. This is my family, always behind me for pushing me to do even better every day. So that's my daughter seeing a shark for the first time in front of her. So these are all things I cherish. So work is not everything. You need to have a good support behind you, and you need a good mentor. You need good parents to help you out, and all these things always help you in getting better at what you are. And Arushi told me before organizing the program that we have to advise the future dentists. So I don't have much advice to give you guys because I am learning even now. But I found a few points that might help you. So I just put it down in one slide. See, find your goal early and work towards it only. Don't stray away. See, you might want to find what you want to do very early. The earlier you find it, the earlier you can move towards it. If you're very late, you are losing a lot of precious time. And if you have one interest, work only towards it. So somebody decides that you want to be a dentist in
फर्क
Canada,
पड़ता तो
there is
है
no
ही
point that you work as
दिमाग
an
तो उसमें
associate in
है
any
ही
clinic or you work in, you try your NEET and all that. There's no point. You have to go to Canada as a dentist Go to the Canadian website, find the flow chart, what to do, and start doing it. That's all. Find a training program that can help you with the licensure procedure of the country and move. That's all. So you have to find your goal early. Second one is have an equally motivating backup plan. See, most of the time, the first thing we try may
यार
not
ये तो
work.
है, ये तो सच
So
में
that
है।
shouldn't get you discouraged. So you should have a backup plan. There should be a
नहीं है,
secondary plan. So some,
कोई बात नहीं
as
यार।
as a joke, we used to say, when we have given the options
ये
of
तो ऐसे
choosing a
तो यार
specialty,
एलिगुएल भी है
we
बेस्ट।
sometimes think of orthodontics. And if
हाँ
not, let's choose pedodontics. It's not
हाँ,
a bad thing actually. You should have an idea of
तो क्या
what
हो
you
गया,
want to
ऐसे नहीं
do. If
होता।
not, something works for you.
ऐसे तो बहुत तुम्हारे
Third,
क्लासमेट
and the
आएंगे
most
जो पता नहीं
important
कहाँ
thing
कहाँ
is
पहुँचे होंगे।
find the right mentor to guide you. You have to have somebody to tell you what to do.
हो जाएगा,
Maybe you are not
हो
sure of what
जाएगा,
to do because all of us are not from a
होएगा।
family
अब ये बात
where
कंपनी
we
की
already
सिर्फ
have
गूगल ही है
dentists.
क्या?
So some of your parents are dentists, they might help you
देखो
get on the right track.
तो क्या
But
हो गया
somebody
भाई,
might not have a dentist in the family. For
चार
them, it is completely new. So once you finish your college, you are in a world which is extremely competitive and you
नहीं
may
भाई
not know
ऐसे नहीं
what to
होता,
do.
एक्सेप्ट कर
So
लो,
good
क्या हो
teachers
गया
or good mentors can be
भाई, तुम्हें
anybody,
बहुत
but
मेहनत
you
करनी
have to
पड़ती है
find the
यार,
right mentor to help
वो
you the
पता वो
right way.
सारा सारा
And
दिन,
trust me,
यार वो
people
सारा दिन
who are
करते
in front of
हैं
you, who
यार,
have been in
गर्वित
the scene
करता
for
है
a
तू,
long time,
मान मेरी
will know
बात,
what
तू
to do.
देखता है सुझा के।
Fourth thing, don't
हमारी क्लास में एक
hesitate to
आयुषी
ask.
गुप्ता है,
You will
उससे
only
जब भी
gain
पूछते हैं
there.
ना भाई तेरा पेपर
Many of
कैसा हो
us
गया, नहीं
have a
बस
lot
हो
of
गया
questions, but we never
यार,
ask.
थोड़ा
As
सा
a student,
वो
we never
कर
ask
देता
in
है, पता वो
class.
सारे क्वेश्चन
As
कर
a
देता है।
postgraduate, we never ask our
हाँ हम
seniors.
जो तेरे को बोल
We
रहे
have
हैं,
ego issues of asking, or we have slight hesitation to ask because we probably think that uh, we may
मैं
not
बोल
be
रही
right
हाँ
or we
हाँ
might
छोड़,
make an
जब मैं
embarrassment of
कहूँ तो फिर
ourselves.
चुप हो जाना।
No, you can always ask. For example, social media is there now. It's so
जहाँ
easy to
बैठ
ask.
जा कोई नहीं।
Somebody posts a picture, somebody posts a beautiful case they have done. All you need to do is type in the comment section. Don't worry about how many people are going to
कोई
read
बात
it.
नहीं यार,
If you have a doubt, always ask. Use the right platforms to your advantage. Of course, to get you connected, Facebook is there, Instagram is there, your
तो क्या
WhatsApp
हो
is
गया
there.
ब्रो, फिर वो
But
उसकी
the
अपनी
right
लाइफ है
platform
यार।
is what you need. For example, LinkedIn. If you take a look at LinkedIn, it's a professional platform where
तो
professionals
यार
connect
ब्रो
each
ये
other.
बच्चे ना
So you
बहुत
have to
करते हैं,
spend
बहुत
more
मतलब
time in
इसे
the right
मतलब
platform. Or if you are in an Instagram
यार वो
page, go to websites that are in relation to
ये
your
वो
career
ना यार,
interests. For example, you like veneers after seeing the cases today, possibly you want to do some veneers. Go to the sites where veneers are
ऐसे मतलब मैं
highlighted.
हर
You
बैच
might
में
get a
टॉपर
lot
होता
of
है,
points of preparation,
हर
of
बैच में
choosing cases,
मतलब मैं बेस्ट
advising the
हो
patients, and
जाता
things
है
like
यार,
that.
हो जाता है।
Sixth point, think but don't keep thinking. We all think a lot, we keep thinking. But the problem is we keep thinking for a long time. We think for 2 years, we think for 3 years, and we keep on thinking. We don't act. So sometimes I ask my students, what are you doing? So they tell me I am an associate in a clinic. So I tell them, how long have you been an associate? So they tell me, sir, I've been here for 2 years. So I ask them, what do you want to do now? They tell me, I haven't decided, maybe I'll keep working for another 1 year and let's see. So, that's a confused mind and you're just thinking, you're not acting on it. So stop thinking. Don't miss an opportunity to learn. You are in your clinic sometime, you have a person sitting and working in front of you and that person might be more experienced than you. If he's doing a procedure, go and learn. Go and watch the procedure. Watching the procedure or assisting in a procedure, holding the suction and standing there is the easiest way to learn a procedure. You will learn 100 things rather than spending time doing nothing in a clinic. So I'm not saying all of you are like that, but when you get an opportunity to learn, please learn. There is no competition if you decide so. If you think that the world is extremely competitive around you, you will be discouraged. Try to understand that you are one step above the competition. If you decide like
मम्मी
that
पता है
today,
वो
you
ना
will
नहीं, वो
see
वैसे
that
भी जब इसका
actually
पेपर आता
there
है ना
is
वो
no
सारे
competition
क्वेश्चन
around
सॉल्व
you.
कर देता है।
Everybody is just doing, they're
हाँ
just making a living, that's all.
हाँ
And
नहीं
when you see the term difficult case, don't believe it.
उसको आ
There
रहा
is
है,
absolutely no
वो तो होता
difficult
ही है
case.
ना,
So
ब्रेन ही होता है
sometimes you
उसमें
might
से।
see Facebook posts where they say a difficult root canal. Did it in 3 hours, 20 minutes after using
मेरी दोस्त है
13
ना
packets of
स्पाइसी,
files. That is not a difficult case. That is just a long case. So you have to understand some cases take long time, some cases are fast. So there is always a short case or a long case. There is absolutely no difficult case. There is no theory without practical and practical without theory. This is something I explained quite early in the slides. And the last
अरे
thing I want
गूगल
to
में
tell you
ऐसे थोड़ी
today
लिखते हैं
is
नॉर्मली,
you need to be in
ऐसे
the
नहीं
right
लिखते
place
गूगल
at
में
the right time.
भाई,
So that is something that is not in your hands. That is something that is your luck. So you have to be in the right place at the right time. That means you have to be with the right people. You have to be in the right clinic. You have to be in the right learning environment. Then only you can actually utilize it for your benefit. So again, am welcoming all of you to reach out to me, connect with me on LinkedIn, please, because that's a great way of seeing each other's work and getting connected in a professional manner will help each other in the long run. I might benefit from all of you, you might benefit from me. So feel free to connect with me on LinkedIn. I'm always there, and you can always inquire your doubts, send me your cases, and in any way, whatever professional advice you need, I'm always there for you. And again, for those of you who visit the Inamed website, I have spoken to the management and organized a 10% discount in the fees for anybody who wants to do a training program from Arushi's Dental Club. So that's something I've already spoken to them and they've agreed on.
Sir, I have a
And
question.
I again thank Arushi for organizing such wonderful programs. And I hope that we can benefit from these things again. So I'm open to any doubts you have. I'm open to any discussion now. And if you want, we can have a interactive session right now. I hope that's okay.
Thank you so much,
Sir,
sir.
can you have some session on this? People want to get jobs or something, or you can help them in that because many people have done their studies,
Uh,
experience and all. Can you keep a seminar on that, or you can guide some people via LinkedIn or via something?
यार पता है जो इसका दूसरा इंटरव्यू है ना किस्मत खेल गई दूसरे इंटरव्यू से
Sure,
बोल
sure.
ना
Why
बता दिया
not? Why
पाइथन
not?
की
We
वो
can
थी
always do
तो खुद ही तो कह रहा
something like.
फिर
I think what you're trying to say is you need a guidance in your
अच्छा
career
फिर
to find a job. Is that what you're asking?
Right, right.
Of course. There are a lot of programs around you. There are a lot of jobs around you. I probably will try to help you find something like, for example, how to use LinkedIn, how to connect with the right HR of the right hospitals, how to advertise
Yes.
yourself on LinkedIn so that they start watching you. So there are a lot of things like that. We can always arrange a seminar or a webinar on that too. I'll be always happy to help you. Some questions are there, I think, in the chat section. So I'll start just reading them out and
Please
maybe
conduct a
answer a
seminar.
few of them.
Please conduct a seminar on that.
So the second at the beginning of the webinar, you explain about other courses except MDS. So what is the future as a dentist MPH course? Can a BDS doctor become a hospital super or superintendent or only MBBS doctors can? Okay, so basically, I think what you're trying to ask is about the MPH course, that is the Public Health Masters. So basically, public health is a course where research opportunities are very high. Unfortunately, an extremely saturated course right now in India because there is a public health master's program which was earlier called community dentistry masters. Now it's again
थोड़ा
public
अब
health.
जब मैं बोलूँ तो फिर
So
चुप हो जाना
other than that, we have hospital MPH courses now also,
यार गूगल
but
में तूने सबसे पहले किया
extremely saturated in India. But you will always find a lot of research opportunities outside
कोई
India
बात नहीं
once you have completed your MPH. So
दिल पे
probably if you
लगा
are
रहा है ये
thinking
तो
about
बहुत
a
दिल पे
public
लगा
health
रहा है
masters,
उनकी सिलेक्शंस
you
को
should start thinking about
हाँ
a country other than India to settle down in.
हो जाए
I'm not sure if only an MBBS doctor can become a hospital superintendent or a BDS can. That I'm not sure. You will have to find that out. So can you please tell us what fellowship programs did you do? Okay, so I
और
was
क्या
very passionate
भाई
about
तू
aesthetic
देख बुन्नू
dentistry. So
गर्वित
I've
को
done
क्या
a
करता है
course
गर्वित अपनी
from an
जिंदगी
institute
में
called
उससे हमें
CAPMIA.
फर्क नहीं पड़ता
So CAPMIA has beautiful aesthetic dentistry programs. You can
मैं सही
always
बोल रही हूँ
find them
यार
on Google by
तुझे
going to
जहाँ तेरे को जो रास्ता
CAPPMA.
मिले उसमें एक्सेल
And there are
खुश रह तू
few
दिल
other
दुखा लेता है मैं
programs
सिर्फ उस
like,
दिन
for example, Belograd
खुशी तो
Academy
मना
in Ukraine.
बट
So Belograd is again another place which I would recommend you guys to go once the travel restrictions are banned, are
दुख
lifted.
मतलब
I'm sorry.
हाँ एक होता है
So there are a couple of fellowship programs you can do in India as well. So I've done a fellowship program on lasers from India again. So lot of fellowship programs are available in India.
क्या
Some are
मम्मी वो
short
ना
term, some are long term.
मतलब
For example, if
चाहे
you
चलो
go to
उसका
a
हॉबी
particular
क्या है वो
state,
अलग
for
बात है,
example, to
बट वो
decide on
ज़्यादा
Tamil Nadu,
मतलब जो
just go to Tamil
स्मार्टनेस है
Nadu
ना
and type
वो
the
पूरी
dental
दिखाता है वो,
universities that
चाहे
you
उसका
get.
हो
So,
चाहे
for
ना
example,
गूगल में।
Dr. MGR Medical University in Tamil Nadu, you go to Google, type Dr. MGR Medical University, available fellowships for BDS. You will get a list of all the fellowship programs that the university
वो
provides in the
पहचान
state.
लेता है, ये तो हमने
So
देखा
most
है
of them
थोड़ा
are
सा।
1 year, most of them are 2 years, some of them are 2 years. So
और
you can
कई बार
always
किस्मत
go
भी काम
to
कर
any
जाती है।
particular state. Suppose you go to DY Patil in Maharashtra, you can go to Maharashtra and see the available fellowship programs. So DY Patil has courses,
You will
Manipal has
always
courses,
find
Vijay
people
Medical
who
University
उनसे ज़्यादा
has,
आता
Savita
होगा,
has. Lot
बट
of deemed universities are there
तू
in
भी
India
बहुत
now,
अच्छा
and
कर
most
रहा
of them
है।
provide fellowship programs. So that you have,
देख
and
ये
again,
तो
like
बहुत
for
जल्दबाजी कर रहा है,
universities like
क्योंकि
the one I showed you, they
बहुत
also have
जल्दबाजी कर रहा
fellowship
है ये,
programs for
बच्चों की तो मम्मी
a
तो
lot of
भी नहीं
students in
मिलती।
India. So there is an
इसने तो अभी चार
abundance of
टेस्ट दिए,
fellowship
उसमें
programs in
जल्दबाजी कर
India,
रहा है।
but you can actually decide which subject you want to learn, and then you can
वो सब कंपनी वैसे गूगल
finalize
देखो
a
तो
subject.
सब थोड़ी गूगल में लगेंगे फिर जाके।
Okay, you did inquire in
हद
Delhi for
होगी।
aesthetic dentistry. Okay.
हाँ,
So
ये
basically, the
गूगल में लग
idea
रहे
of
हैं
a
ये दोनों,
fellowship program is not to
गूगल में
make you
ही।
a postgraduate.
ये
The
पापा का
idea
एक
of
भी
a
दोस्त है
fellowship
गूगल में।
program is to make you trained in
हाँ,
a particular
फिर
area
ऐसे नहीं
of
होता,
interest. For example, if you choose aesthetic dentistry, then you
सबकी
get
सेम
better
जिंदगी
training.
है।
That's all. So it's usually 10
हाँ,
days or 2 weeks or
बताओ ये
1 month
इतने
or 6
बिलियनर
months or
रहे
1
हैं
year.
गूगल में।
Whichever it is basically a
बता,
training program. So you may have
अरे ये
uh,
यशिकर कौन सी गूगल में है?
somebody who's a mentor for the program,
तो
and he
भाई
will train you
मेहनत
with whatever he knows. So
ये
that is the idea of a fellowship program. I
एक
am an
कंपनी के
intern right
पीछे से
now
रो रहा
and
है
I'm
तू तो।
interested in aesthetic dentistry. Okay, so what
हाँ
you need to do is
यस, मैं तो
find
कह
the
रही
aesthetic
हूँ।
dentistry programs in India. Yeah, I have a question.
हाँ,
Yeah, please tell me.
ये तो पता नहीं है इसको। सुंदर
My
पिचई का
question
गूगल
is
में हुआ
about
था
actually
पहले,
I
I'm a
can.
third year DDS
कहीं नहीं हुआ
student
था उसका।
from Tehran University, Iran. Uh, I'm a third year, and my
इसमें
question
देखो
is
सिर्फ उससे सीखना
one
चाहिए,
of my
कंपटीशन नहीं करना
seniors
चाहिए।
actually told
देख
me he's a
कंपटीशन नहीं
resident
करना चाहिए, तो
in
गर्व
oral
से।
maxillofacial surgery.
हाँ,
He said that after you finish
Where are
your,
you
अब मेरा
from?
कराओ।
I'm from Iran.
Okay, yeah.
इतनी जल्दबाजी
Yeah.
मत कर, चार कंपनी आई।
Resident in
अरे ये
oral
तो
surgery
आज
in
नहीं, ये
India
तो जिस दिन
means
गूगल आई थी
a
उस दिन इसने
person
जल्दबाजी
who
में
is
डाली थी
doing a
कि मेरा तो गूगल
postgraduation
में
in
होना
oral
चाहिए।
surgery. So in India, the
मतलब
idea
इसी
of
एक कंपनी आई,
residency
इसी
is
में होगा मेरा
to
तो।
do a
थोड़ी
postgraduation.
होता है।
But the idea of doing a residency in UK is not a postgraduation.
हो
So in
गया वो
some
उसका बाय
countries, the
चांस
word
है,
residency has different
वो तो
meanings. So you
जानता है
can be
उसको
a
बाय
resident
चांस है।
before
बहुत बच्चों का
joining
हुआ
a
है
training
गूगल में,
program.
उसका थोड़ी
Hello,
हुआ
can
है।
you hear me?
Yes, sir.
So in some countries, they allow you.
बता, सलोनी का माइक्रोसॉफ्ट में हो
Let
गया।
me complete. In some countries, they allow you to
अब
become a
मेरे को तो भाई
resident in a
ऊबर,
particular
फेसबुक,
subject. For
ट्विटर
example, if you
सारी
choose oral
अच्छी
surgery,
कंपनी
they allow
लगती
you
हैं।
to become a resident in a hospital,
क्रॉसफिट
so
सारी
that for
अच्छी
a period
कंपनी
of
है।
1 year you can
मेगा
watch
मेगा दीज
what
आर
is actually happening,
सिर्फ
get
उससे
yourself
सिर्फ इंटर्न लगने से
pre-trained,
कुछ नहीं होता,
and
इंटर्न के
then you
बाद भी
can
मेहनत
join
करनी
for a
पड़ती है।
master's program. So that is the idea of
और क्या,
residency in some countries.
गूगल में
For
इसको
some
कहाँ
countries,
जाएगा
a
ना, इससे
postgraduate
डबल
program is called a
इंटेलिजेंट
residency.
बच्चे
So a
मिलेंगे।
resident in a certain subject can mean both.
हाँ,
Okay, I got it. Actually,
Is that
my
clear?
question is
नहीं मैं
about
बुन्नू ना,
yes, sir.
मैं
Yes, sir.
बुन्नू
That's
को
clear,
बता
sir.
रही हूँ आज लाइफ में।
My
अगर ये
question is
सपने
actually
देखो,
he
मैं भी
told me
सीख
he's
रही
a
हूँ इसलिए
senior
बता
here.
रही हूँ,
I'll
मेरे
get
को
back to the
एक्सेल नहीं है,
question.
लेकिन इंटरेक्शन
I'm a
विद
third year
पीपल,
student.
स्पीकिंग,
30
टॉकिंग
TDS. Here
is
we
very,
have
and
TDS. We
Chantagiri
don't
is
have
very
TDS.
nice, you
We
should।
have
Okay.
doctor here.
हाँ
So he told me
Okay.
that after you finish your DDS,
हाँ,
more probably you should not go for a specialization just
वो
after
तो मेरे को
finishing the
पता है, इसलिए
DDS.
मैंने इसको बोला है।
You should
You can do a
work
residency. Is that
or
right?
no, it's like
कोई बात
you
नहीं
should
मम्मी,
work as a
कोई बात
general
नहीं।
practitioner. You should work for 5 to 6 years. Like you should work like an orthodoncy, an endodontics,
Yes.
and all those fields. And then after you choose your specialization over there. So
Yeah.
is
So
it
that's
better
actually
we
a very
choose
good
it
advice.
better?
मम्मी ऐसा ये मैं भी नहीं हूँ,
Okay.
मैं भी नहीं हूँ उनकी दोस्त, मेरी क्लास की ज़्यादा बच्चों, लेकिन पता है
Yeah. So I'll answer your question now. Okay. So that's actually a very good advice because India is the only
नहीं,
country where they
मैं
allow
बताती हूँ
you
यार,
to do a
दोस्त
master's
मत
program
रहो,
immediately
लेकिन
after
ना
you
तुम्हें
finish your PDS.
मतलब
For
एक
example, if you
ऑब्जर्वेशन
take
होनी चाहिए कि
UK,
करते
it
क्या
is
है भाई,
compulsory that you have to be a general practitioner for 3 years
क्योंकि
before
देख
you choose a master's
हाँ
program. The reason why they have a rule like that is because
ऑफलाइन तो
allowing
नहीं,
the student
वो
to
कोई बात
understand
नहीं,
the subjects when you practice will
वो
make the
कोई बात
student
नहीं,
get a
दोस्तों ने
good
थोड़ी
idea
कराया
of
उसका
which subject
सिलेक्शन।
he has to choose. The program with
हाँ इसका
joining
भी
for a
खुद ही
master's
होगा, दोस्तों
program
में थोड़ी
immediately
होगा।
after BDS is I have a colleague, for example, who's an orthodontist,
किस्मत की
but
बात
does
होती
not
है.
know how to give an inferior alveolar nerve block. That's because in VDS time, he gave nerve block for about 5 patients, and then he got a chance to do his master's, so he joined for
बता.
orthodontics. And throughout 3 years, he's never given anesthesia because orthodontics doesn't require anesthesia. And after 3 years, he's a full-fledged specialist in India. Unfortunately, he doesn't know how to give a nerve block. So this is a problem with all the trained students in
एक तो ना
India.
बुन्नू डर बहुत रहा है.
Unfortunately, there is no
पागल है
rule
बुन्नू.
which says that a experience program is a must in India, but it is a very good thing if you can work at least 4 to 5 years
कुछ
after
नहीं
your
समझ
BDS
में.
and then decide which subject you want to do and
तू
then
ही
go for
समझाता
your
था मेरे को कि
masters.
तुझे
So
टॉप
that's the
क्यों
right
अचीव
advice
करना
that
है.
you got.
इंसान भी तो है तू.
Thank you very much. Thank you very much.
Yeah. I have a
अरे
question in the
होएगा
chat
ना
section.
फिर.
So, what
वेट देख, अब
courses
तू
do
10
you
दिन भी
suggest
नहीं
for
वेट कर रहा.
first and second year of
ये
BDS?
तो मम्मी बहुत जल्दबाजी मचा
Uh,
रहा है.
Okay, so first and second year of BDS, you should concentrate on BDS because you are just into the field
हाँ
and you
ले
haven't
ले.
seen a patient yet.
अभी आ गई
So
तेरी
maybe
सारी.
when you
कल
are
दो
in your
टेस्ट
fourth
हैं.
year or an intern, then probably
अरे
you
फक
can
वही.
start thinking of courses which you want to do. That will be a better time. So this is again one more problem that we have. For example, if you take the BDS program in US, right from the time a student joins for a BDS program, that is your first year, there is a compulsory posting in the oral medicine department. So that is
अरे मम्मी
just
अभी तो
because
इसकी
you
आज
need
देखो
to
इसका
pick up
टेस्ट
a
अच्छा हुआ.
mouth mirror and probe,
इसको
and
मैं
they just
कहती हूँ
ask you
कि
to start
तेरे
examining
टेस्ट अब हो
patients.
रहे
That's all.
हैं.
So
जो
you
समय
have
मिले
no
उसमें अपने
idea of
क्वेश्चन रिवाइज
dentistry,
कर
but
ले.
you're just holding a
बस.
mouth mirror and probe,
और
and
अपनी
you're just
अपनी
looking
अपने
around the
सारी
mouth.
तरकीबें
They
लगा जिससे
probably
हेल्प
ask
नहीं
you to
ले.
count the
क्योंकि
number of
अभी तो देखो
teeth,
इसको
try
सीख
to
मिल गई है.
identify
इसको
black
पता. अब हम
colors, and
कुछ
they
नहीं कह
tell
रहे.
you
इसको
that is
इसको
called
पता चल गया है
cavity.
कितनी मेहनत
So you're
चाहिए.
basically
खलबली
sitting
करता है
there.
इंसान.
But the advantage of it is, over a period of
कर रहा
4 years,
है.
you
लगा
are
हुआ है.
always
बट
watching
जो भी है
patients.
पता
So
लग
by
गया
the
ना.
time you are in the third year and you start your clinics, you are already very well aware of how to use an instrument, how to examine
बुन्नू
a
लक की
patient,
बात
how
होती
a
है. लक की
dental
बात
chair
होती
looks
है
like,
यार.
and
जिनके
how to
ट्विटर में
switch on your
इंटर्न लगे वो
electrics.
अच्छे बच्चे नहीं है.
So this is something in India that is a basic problem. Till second year is
जिसकी
completed, you have
तेरी जहाँ
absolutely
लगेगी
no idea.
क्रॉसफिट में या
And
जिस में
suddenly in
लगेगी
your third
तेरी.
year, you have to deal with all the subjects. And by the
वो क्या
time
अच्छे बच्चे नहीं
two
है.
years are complete, you have to learn about 8 subjects
वो
and then
जैगवार में
pass
लगा
out.
हुआ है पुलकित.
So as a BDS first and second year student in India, right now, just learn your subjects very well. If possible, try to gather
अब वो
whatever subject
उसकी
you can
जैगवार में
get from
इंटर्नशिप
social
लगी.
media, from
तो
YouTube.
वो
There are
क्या
so much of content
अच्छा
available
क्या
all
था
around
उसकी.
you.
दो महीने की
Connect
जाके
with the
लगी
right
इंटर्नशिप.
people. Don't hesitate to ask what you need
वो
to
भी रोता
ask
रहा
and
होगा ऐसे
start
यार. 10
learning
दिन हो
on
गए
a
लग नहीं रही.
very brief basis.
कंपनी आ रही है
But first
भाई.
and second year
अभी
of
की
BDS is
कंपनी जो
too
है ये
early
गूगल और
for you to
स्प्रिंगफील्ड के
understand
अलावा
the
कौन
clinical
बच्चे
subjects.
लेके
So
गई है.
maybe when you are introduced to them, you will have an idea of
माइक्रोसॉफ्ट
which
में तो तुम
course you
सबका
want to
पत्ता
do.
कट
Like
के
I
चला
have a
था.
lot of interns who come to me for fellowship programs. They come, they learn, and then they go back
मम्मी
to their
बंद कर.
internship and they do cases in the college. Because they say that after doing the fellowship, if they are posted in consult department, they get a better idea of doing fillings. So that's a good thing
नहीं
you can do
इंटर्नशिप
when you are
सीजन
an
पूरा ऐसे
intern,
ही होता है.
but not
स्ट्रेस तो
now.
रहेगा देख. और इसमें जो भी
So
होगा
are there
उसका
any
डबल
programs we
बुरा
can
लगेगा.
apply
ट्रिपल
during
बुरा
BDS?
लगेगा.
Yes, when you are intern, you can
तो
join
कोई बात
any
नहीं.
fellowship program, hands-on
होप
courses,
रख बस तू.
workshops.
और
They may not be
just
certificate
sail
approved
through these
programs,
days.
but there is no problem in joining. You can do, provided your head of the department allows you to go and attend these courses by taking leave from the college. So again, not when you are running around catching patients in your BDS time. This should be after you have completed your BDS and you are doing your internship. Okay. So I think questions have stopped now. And I see about 50 people participating. So I hope all of you are attentive and you have actually maybe benefited something from today's program. Uh, so if you have any remarks, please feel free to talk to me, or you can always connect me and share your experiences. So Arshi, are you there?
Yes, sir. Thank you so much, sir. We learned a lot
Yeah.
from you today, and we appreciate you taking out the time. Everyone is saying thank you, sir.
Yeah, no problem, no problem. I
Thank
can see
yes,
some familiar names as well.
yes, sir. So I'll just
Okay.
put in the post-session quiz.
Yeah, sure, please.
हाँ जी. Thank you so much, sir. Have a great night. Take care.
Thank you, thank you. I'm exiting the session now. Thank
Yes.
you very much. Thank
Thank
you,
you,
everybody.
sir. Thank you
Yeah.
so much.
Yeah, okay.